Next on the agenda we have Ms. Judy Dinkle, and she is a senior program analyst. And she comes to us from the Office of Family Policy, Children and Youth, Military Community and Family Policy, Washington, D.C. Ms. Dinkle, she supported military families as an Air Force officer and as a civilian. She currently serves as a senior program analyst within the DoD Office of Family Policy with responsibility for policy and programs that support military families. She facilitates collaboration between the services, promoting continuous improvement of existing programs and development of new programs based on available evidence of effectiveness. Welcome, Ms. Dinkle.
Thank you. Is everything on? I'm good to go? Okay. Well, thank you very much. I'm very happy to be here. Before I start, let me just say that I have to do this briefing 5 times over 2 days. And so I do have some notes here, because by the time I do this a couple of times, I'll be repeating myself, and I won't know if I said it here or in the last session. So I don't normally rely on notes, but I just want to make sure I don't miss anything. So yes, I'm here to talk with you about some of the things that we're doing out of our office at Military Community Family Policy, Office of Family Policy. I'm here to talk to you about 5 resources, and I was very glad that I showed up at the tail end of the Army One Source briefing. Am I in the right place? Sorry. Because I think one of the questions that was asked about sustainment of results, we have a tool that might be helpful in doing that. So that's always good when we find that we're doing things that complement other initiatives. And a little bit of overlap is good, unnecessary redundancy is bad. So it's good to know what each other is doing and how we can help each other out. So anyway, happy to be here today. I want to share with you, go ahead. A couple of things in terms of concept or theory before we get into the nuts and bolts of why I'm here. We have a Department of Defense instruction, we call them DoDs, and one of them is on military family readiness, which is what our office is all about. And we have a definition for what we think military family readiness is, and I would be pleased as punch if you would adopt this definition as maybe a goal for your work. It is a goal for our work. We say that if what we are doing supports this definition, then we're on track. If we get too far outside the bounds and what we're doing doesn't have anything to do with this definition of military family readiness, we need to rethink what we're doing. So our goal is to do things that will help families have the knowledge, the skills, and the resources that they need to take care of themselves. We don't want to foster dependency. We want families who are able to take care of themselves. But we also want them to know where to go when they do run into those situations where they need a little extra support. One of the things we also like to promote is that our families are strong. They're not needy. But there are times when a military family will encounter a situation where they need a little extra outside support. But that kind of support is there to help them stay on track, get back on track and stay on track. So this is the definition of military family readiness that we use at our office. And I have this hanging on the wall in my office, and I would encourage you to do the same thing, whether your office is an office or your home or wherever it is you do your work. And the 3 areas of readiness that we focus on are mobility and financial readiness. We hear regularly that when families reach out, one of the main issues that they ask for help with is financial. And with folks who are coming on and off deployment, sometimes it is getting used to loss of combat pay or getting used to managing that combat pay when they get it. So those kinds of transitional sorts of support is what sometimes your families may need. Mobilization and deployment readiness, of course, that's your bread and butter with your folks coming on and off of orders in the National Guard. And then personal and family life readiness. We know that all families have challenges. Military families have all the same challenges that non-military families have, but they're overlaid with the challenges of being in the military. So those are the 3 domains of military readiness that we focus on. Next slide. A second concept that we want you to become familiar with, if you're not already, is the concept of a family readiness system. And when I was hearing the conversation about the Army Covenant, or the Community Covenant, I was thinking that the people who sign that are a part of the family readiness system. And when you were talking about what I heard was communities of practice. There's geographic communities, and then there are communities of practice. People that see themselves as being a member of a community because they do similar things. Healthcare can be a community of practice. Schools can be a community of practice. Law enforcement can be a community of practice. And if those folks see themselves as a part of the family readiness system and they realize that they all have that shared interest, that can have a catalyzing effect on their efforts and kind of unify what it is they're trying to do. But the military family readiness system is the network of organizations and agencies and institutions and individuals who see themselves as being a part of supporting military families and their readiness. Okay. Okay, and then the family readiness system, the concept of no wrong door. Several years ago, I'm sure you all heard the same thing we did, that the families were complaining because there was too much out there. There were too many resources. There were too many websites, too many 1-800 numbers, and they didn't know who to call for what, and they didn't know how all these systems worked or how all these resources worked. So rather than try to figure it all out, they just didn't know what to do, so they did nothing. And so our strategy to respond to that was, rather than trying to educate these millions of family members who are out there, we should educate each other about what it is we all do, so that when families walk into our door, it may not be the door where they're going to get their need met, but we know where they need to go. And we can get them hooked up smoothly, warmly, safely, seamlessly to the resource that they need, so that they don't feel like they're being shuffled about from one place to the other, or they don't feel like they have to know everything. They can walk into a doctor's appointment with their child and talk to the pediatrician about, well, the reason I haven't been keeping my appointments is because I can't pay the bills. Okay, well, that doctor or that nurse practitioner or that PA needs to know what resources are available for military families in terms of their financial readiness. So that's an example of somebody hearing a symptom, an early warning sign that this family may be getting into some trouble, and that person who's not a financial person can hook them up with a resource that they need. Okay. This is a list of the types of services that military families typically need. Now, there are some families that go through their entire military career and they never really miss a beat. Things just go smoothly for them. And there are other families who have little bumps along the way. And these are the areas where the bumps typically occur. Financial is one, careers for spouses is another, emergency family assistance for critical incidents that happen, transition assistance. And we look at transition assistance as being more than transitioning out of the military. We see transition assistance as being helping families transition through life's transitions, having a baby, getting married, having a baby, or having a baby and getting married. Deployments, coming on and off deployments, children leaving home, those kinds of transitions that all families have. Military families have those transitions too, so helping them with those transitions. The other transition is, for your folks maybe not so much relocation unless you're in AGR and you get assigned to another unit or something. But in the active component, relocation is one of those things that causes a lot of stress. So these are the things that we tend to create our resources around, create our services around, because they're the kinds of things that families have told us that they need. Okay? All right. So 4 things that I want to share with you. One is about community capacity building. Well, actually 2 of them are about community capacity building. And so we're going to talk about a curriculum and a needs assessment tool, or community assessment tool that's available for you. But community capacity building in our mind is helping folks who live in a community, and now we're kind of talking about a geographic community, folks who live in a community, helping each other so that the community functions better and the individuals within that community function better. So that's what community capacity building is all about. If there's someone mentioned earlier that if people don't have a job to do, they lose interest. So there has to be a sense of shared responsibility for that community to coalesce and stay together. If I feel like you need me, then I'm going to show up. But if I don't really feel like I have anything to offer, or that what I have to offer is not of particular value, I may lose interest and not show up. So that sense of shared responsibility and everybody knowing what they bring to the table is a huge part of a successful community capacity building effort. Okay? So you have people who are in formal and informal relationships within your community, and those informal and formal networks and relationships work together to build strong communities. So by formal relationships, we talk about, for example, a community of practice. I mentioned earlier law enforcement. That's a formal network. The court system is connected to the police department, and the police department's connected to the public defender's office, and those kinds of things. Those are formal networks that have a way of working together. They have policies and procedures and rules and regulations that govern them. There are also informal networks within the community that can help sustain those formal networks. And if you know what those informal networks are within your community, the formal networks can work more efficiently. You take advantage of those informal things, which is where families go, and you leverage those informal supports to make your formal networks stronger. Healthcare is another formal system, formal network that exists within communities. So if we educate aunts and uncles and grandmothers and grandfathers about child care, then when mom calls her mom for advice on what to do with the baby, then that grandmother is better positioned to help because she's been educated, or the grandfather's been educated about what to tell their daughter about, or their son, about how to take care of their child. So those informal networks become very responsive and more capable of doing what they need to do. So when the informal networks and the formal networks work well together, there's collective competence, and the whole thing works that much better. Okay? All right, so there should be 5 things on this slide. I thought of another one after I submitted my slides to the NGB folks, so apologize for that. But I'm going to talk with you about a curriculum, which I think might be a resource to deal with that sustainment issue. An individual community readiness inventory, or ICRI for short, we acronym everything, which is a way to put your finger on the pulse of the individuals, the service members in your community, their spouses, how they're doing and how they think their community's doing. So it's a way to ask questions about that, and I'll talk more about that in a minute. And then there's a DoD asset map, which is similar to the one that Army OneSource talked about. This is one that you can actually, it's very interactive, it's one that you can actually build your own information from, and I'll show you that. The Family Readiness System toolkits, and I have an example of that. This is if you're doing any kind of public awareness, marketing, social media. I brought the example of the outreach toolkit for your public affairs folks, if you have them, if you have public affairs folks. But there's also on the Military OneSource website, there are other examples for leaders, so military leaders, in service providers as well. So service providers that work for the department and those that are in the community. And then the 5th thing that's not on there is the Department of Defense has a state liaison office, and their job is to work with state legislatures on initiatives that have been determined to be of interest to military families at the state level. And I'll show you a slide on that, which will tell you what I think it's 15 for items have been identified by folks like you telling us these are the things that are important to families, military families out in the states, and these are things that we need support in changing legislation. So I'll talk about that. Okay, so the Community Capacity Building Learning Modules, this is a curriculum that will be available to you after the first of the year, probably in January, we hope. And it will be online on Military OneSource. It will be available to everyone. It's not CAC enabled. It's not something that you have to work for the department to get onto. You don't have to be on a government computer. You can use it from home. And this is something that I think that if you had, for example, all the signers of your community covenant agree to take this curriculum, it provides you and anyone who takes the curriculum with a process for building community capacity. It is results driven, so it gives you it helps you to establish goals that are meant to address the issue that brought you together. So if you have an issue in your community, safety is the issue, and you have your law enforcement folks there, and you have your traffic people there, and the people who do lights. I don't know who those people are, but people that put lights on streets. All those people are on this committee, and they're all trying to, make this place a safer place for military families to live. This community capacity building curriculum, if every one of them has taken it, they're all on the same sheet of music, they're all speaking the same language, and the curriculum itself actually has resources and tools that you can use to build your community capacity building plan to make your community safer. So it's an extremely helpful, I think, tool for you to use. And the NGB folks have told us that we're going to be invited back after the first of the year. I guess you're having another meeting, something like this, and we're going to come back when it's live and actually demonstrate it and show it to you. And we also are thinking about maybe we'll do some webinars. For those of you who won't be at that meeting, maybe you could actually attend a webinar and see how that works. So they're open to the public, so your community partners, your civilian community partners who are not a part of the Department of Defense will still be able to take the curriculum along with you. And the resource documents there are there to help you use the curriculum more effectively. Okay? All right, so these are the topics, and last time I ran out of time, so I'm not going to spend a lot of time going through that. But these are the topics that the curriculum covers, and go on to the next slide. One of the things that we developed to supplement this curriculum is what we call the Individual Community Readiness Inventory, the ICRI, and it is a 10 to 15 minute survey inventory that you can send out to your service members and their spouses. So there's one for the service member, one for the spouse, and ask them to complete that, and then you get the results back to them, and then we're going to demonstrate this in January or whenever you have your next meeting also. But you will be able to pull a report, and you can do it at a zip code level, at a county level, at a state level. You can do it at a regional level. So if you're looking for how things are going in this part of my state as compared to this part of my state, you can actually do those kinds of comparisons. And it will help you to, you will find out from the service member, for example, what he or she thinks about their own capabilities. So it asks them questions about how they're doing, but then it also asks them to give you their view of how their community is doing in certain areas. So it asks them questions about access to health care, access to education for their children, those sorts of things. So it'll give you individual information and community information that we think you will be able to use to decide what it is you maybe need to work on. Again, it only takes 15 minutes. That one is not going to be available probably until sometime in the summer. We want to go ahead and launch the curriculum even though the tool is not going to be available, but we just didn't want to wait. Now, the last group I briefed, I saw some rolling of eyes, and one thing I always like to say when I come to groups like this, and I'm from OSD and I'm here to help you. If you've got something already that works, that's fine. This is for those of you who are looking for something to use for this particular purpose. So there's no obligation, it's not mandatory. It is strictly a resource for your use. Yes, sir?
Is this just for National Guard, or is this going to be for all branches?
All components, all services, all components.
Is this being marketed to the other components also?
Yes. Yes. Yes, ma'am.
Is any of these available in Spanish?
Good question. Has not been translated. Good question. Let me write that down. I got some really good feedback from the last group, by the way, so this is always very helpful to me.
When you're saying you can pull the reports too, and if it's for all services, can you pull it like Air National Guard, Air Force, so you see the services?
By component? Yes. Yes, absolutely. You can do it by active versus reserve component. You can do it enlisted versus officer. You can do it. Now, we don't have it by each pay grade because we know some of the units are very small and you may only have one or two of something, and you don't want to. It's all de-identified. This is all no PII. So you'd be able to say how many people in the E1 to E6. You can do that. Yes, ma'am.
So Judy, just to clarify, this is a tool that the states can use or the programs can use. They determine who's the recipient of these surveys, and then probably be a special link or something, and then those results are compiled by the
you
system and provided to the asker, the initiator.
Yeah,
So
they're compiled automatically.
Everybody in your state, unless you have everybody's email addresses and they answer it.
Right. You would establish the pool, so who the target is, and you would send out an email with the link, and then you would say give them how many days to finish it, and then when it's over, then you would pull your report. Right, and I'm going to show you a couple of slides that kind of show that a little bit. Okay, next slide. Okay, here we are. So this is the introductory slide. This is what the service member would read. This is where he gets his information about why you're doing this and what's in it for them. And this is not every slide. I mean, this is not every piece of the. I just picked and chose some of the things. So this would allow you to select, for example, the geographic area that you want to hone in on. So if you wanted to do the southern part of your state as compared to the northern part of your state, or you wanted to do a regional thing, you wanted to look at the west part of the United States, you guys got together and decided to do that. You could actually do that. So, and again, it's done by zip code. It's aggregated by county, by state, and by region. Go ahead. Just to give you an example of some of the family information, we did include questions about families with special needs, medical special needs, or educational special needs. So that gives you an example of the kinds of things we're asking. And at the end, when the service member, in this case this is the ICRIM for military, when he or she finishes their inventory, 15 minutes later, they click on the results. It tells them, and you don't see this slide right now, but it tells them these are the things that you, based on the information you provided on this survey, you have a lot of strength in these areas. You have identified some areas where you might want to do some work. For example, you're concerned about your kids. So based on that, we recommend that you contact one of these three resources. And if you can't see it, it is Military One Source. If they're near an installation, or if they're in the active component, they might be closer to an installation. And if not, the State Family Program Director. Piece of feedback we got at the last session from people who aren't State Family Program Directors is, why did we just do that? So we piloted this with the National Guard, actually, and we didn't get that feedback. So that didn't come through on the feedback. So we got it in the last session, and I'm assuming you guys are probably feeling the same way. So I wrote that down, and we'll take that back for advisement. But these are rather than try to figure out what a guy in Idaho who's having financial problems, who would he call in Idaho? We don't know. So we just figured that call someone in Idaho who can help them get to the resources that they need, because those things change day to day, and we know that. Okay? All right, so you, as the administrator, you're the one who's setting this up. You've decided to do this on an annual basis, or you're a biannual basis, or whatever. You set up the query. So you decide who's going to get it, and you decide how long you're going to give them to do it, and then you pull the report. And you can rack and stack it and slice and dice it in a number of different ways. And what you will get, I think, is the next slide. Oh, okay. Just pass through some of that. I think I've talked through some of that. Okay, I want to show the results. Keep going. All right, so this is the group report. So these are the things that you will get. General information. You can query different types of things. Okay, then go to the next. And then this is the example of what you will get. So if you were asked, if these are the questions that you were looking to get information on, this is an example of 124 people answered this finances question, and all of them, most of them said they're doing pretty well in the area of finances. Let's see, not quite so well in the area of activation of my National Guard unit. So 18% of those said not at all or to a small extent. This will just help you decide where the community is, not any one individual, but where the community is and where you might want to spend your time and energy and your valuable resources. What are the kinds of things that you might want to focus on when you're pulling families in for a family day or that sort of thing? Okay? Any questions about that before I move on to the next tool? So that's the community capacity building curriculum and the individual community readiness inventory for a military member and for a spouse. Okay, those two tools. Oh, question?
Sounds like a great tool.
Sorry.
Do you have templates or information? Some people are not as familiar with how to put together assessments. They have the issue, this is the issue, but they don't know what questions to ask to really kind of determine what it is they need, how they need to ask the questions. Do you have templates like around topics like you talked about?
Not Not here, because we're not talking about one-on-one conversations here. We're not talking about that. This is an online tool that is completely anonymous. Yeah, so you're never going to know how that particular soldier's doing or that particular airman's
Not
doing.
that, but like, for example, if you think you in your gut, you're saying, I think I have a state issue around unemployment, right? And you want to use this tool, what set of questions do you have? Any type of templates built that you probably already have?
No.
Okay.
No, this would help you identify that the employment is the issue. Drilling down into that is not what this is designed for.
So in other words, you can't tailor the questions, but the questions are already in this.
Correct. But you can decide which one you want to.
Right.
They'll answer they'll answer the questions they want to answer. They don't have to answer any of them. But you can pull the questions that you're interested in. Okay? Yes, sir.
Who has the ability to see that at higher level?
Well, if you're the administrator, you're the one who sees the results.
So if someone at DoD wanted to pull, if they had a question about the employment issues coming out of New Jersey, would they want to see that?
If we wanted to gather information at the OSD level, we would have to create a report. We would have to query like you do.
Because my question would be, if I saw that, as the 108 there with the Family Programs Manager saw, that sounded like a good report, and I queried my wing. But I'm the only one in New Jersey that queried, that used that, and someone in DoD saw that, they would assume that the information on there covers New Jersey, when it only covers the 108 Air National Guard wing. It doesn't touch the Marine Reserve, Army Reserve, Army National Guard, or anybody else.
Right.
Of the 40,000 reservists in the state, I'm only doing it for 1,000 Air National Guard.
Right. Okay. So I think I understand what you're saying. So if you decided in your state that you wanted to use this tool to do an annual inventory, you wanted to use it on an annual basis, of just your wing, we're not going to see that. We're only going to see aggregate data that resides in the system, but we won't see your report.
So you would see there were 10% of the people had issues with deployment. But in reality, that would only be the 1,000 members of the New Jersey Air National Guard, not the 40,000 people that are reservists in the state.
Right. It would the results would indicate that these results apply to this pool of people. It doesn't apply to the active component in this state. It only applies to the wing.
So it would identify the Air National Guard.
For you it will, not for us. We won't see that report. You will see that report. You'll pull that information. We're not going to be looking in.
Right, but
Yeah.
what I'm saying, it would look like 10% of the reservists in New Jersey have issues, as opposed to just 10% of the...
Okay, go back a couple of slides. Let me go back. Keep going. Okay, wait. All right, so this is what you would do. You would select the service and the component within that service. So I'm sorry, I did skip through that slide. I probably shouldn't have. Okay, good question. 10 minutes, okay. Any other questions before I move on? Okay, next slide. All right, so a map. We have a map that is similar to what was talked about earlier, but this is one that, again, is highly interactive, one that you can actually go to this link on the slide here and create another report for yourself. Go to the next slide, please. So I did think to put some screenshots in here, thinking that we might not have connectivity, so I'm glad I did that. You can't really see this probably, but this gives you an idea of the kind of information you can get from this website. If any of you have used these geospatial maps, you know how you kind of drill down and drill down and drill down. All right, so go to the next slide, please. All right, so this is an example of we're now drilling into the Mid-Atlantic. All right, and so say we wanted to find out more about what was going on in Roanoke. We would just click until we got down to the area, the geographic area that we were interested in. And then we would start querying the map about what's going on in that area around Roanoke. So you could say where are the family assistance centers, and then you can do information about personnel and community. So you could say, here's the family assistance center. closest to Roanoke, and here's all the families, and they're all kind of around that Family Assistance Center. That's good news. We got a Family Assistance Center, and that's where the people are. But if you've got a Family Assistance Center here, and your families are over here, as a leader, that's good information to know. We've got resources where we don't have families, and we've got families where we don't have resources. So that's an example of what this map is for. Now, this is CAC enabled, so it's only available for use by people who have a CAC, Common Access Card. So it won't be available for use by your community partners, for example. But you can use it and then share your what you get from it with those folks.
Is this available now, this one?
It is. It's live now at that link, and unfortunately, it's probably finished today, but we have created a less dense version of it, so it moves a lot faster. If you've ever used these maps, sometimes you know that there's so much data in there, it takes a while for it to load. So we've got a more streamlined version. We're calling it the light view, L-I-T-E, the light view, and it'll go a lot faster.
What's the link for that then? What is the...
Go back one slide. 2 slides. Right here. Are you guys getting these slides? Are they getting the slides?
Yep.
Yeah, okay. Okay, good. So if you've got the slides, you'll be able to click on the link. It worked at my desk. All the links that are on these slides worked when I was at the office the other day. So, okay. Next. Keep going. All right. This is the toolkit that I talked to you about, the public affairs. If you click on Military One Source, this link right here, it's a hot link. If you click on that link, it'll take you to Military One Source, and you will find media kits, public affairs, social media kinds of kits for your public affairs folks, if you have them, leaders, military leaders, family program leaders, internal and external service providers. So feel free to use that if it's of use to you. Okay. And this is the last slide, and I'm going to be good today. All right, so here's another link. If you go to this link, it will take you to the website where this information is. There's a map there. And if this worked, I was going to click on one of the states. I would have clicked on Vermont, and it would have told you where Vermont is in terms of state law in creating legislation at the state level to support these initiatives, which folks like you have told us are important to military families. These key issues change every year, so these are hot off the press. They're so hot off the press that the website hasn't been updated. So if I clicked on this, you would see the key issues for 2014, because they're still on the website. But these are the key issues for 2015. So I would encourage you, if you're in the world of legislation and that's kind of what you do, I would encourage you to go to this website, click on your state, find out where they are with regard to these issues, and if you want to have some special attention for your state, we have an office in my office that works on this exclusively, and we have regional legislative liaisons throughout the country. So if there are any of these things that you want to put particular emphasis on in your state, we're there to help you with that. If there are things that you think should be on this list, there's an opportunity on the link for you to contact us, and you can say, I notice that you don't have anything up here about something else, and this is really important in the state of Vermont, and I really want you to consider adding it to the list next year. And then they will contact you, and then you will start that conversation. So that's how we find out, what the things are that we need to be working on. Okay, next slide. Questions?
So is the only vehicle for this Military One Source?
The Military One Source will house the curriculum. It'll be on the learning management system, which is part of Military One Source. Free, open access to everybody. No CAC required. No password. No nothing. The ICRI will be for use by government folks. I'm losing place. The last thing that is on Military One Source, the link is on Military One Source, but the information on Military One Source it's kind of just information. The work that's done is by people in our office. So that's a very human heavy operation.
Just the point I'm making, ma'am, is the beast of Military One Source and going in to find anything.
I know.
Try to pull it out.
That's why I gave you the links.
Great tool like that.
Yeah. The map is not military one source. The asset map, that is not. That's AT&L. They did that
But
for
even
us.
going out to put out to have anybody go in and take any of the surveys and
Mm-hmm.
do any of that is a challenge to get people to go on to Military One Source because of the frustration of trying to find them.
Right.
So it's a challenge.
So I agree with you, and I work there, and I have the problem, so I know. But when you send out the link for the ICRI, it will be to the ICRI. It will not be to the homepage.
Do you have to
With-
log into Military One Source to get into
No.
that then?
No, you will send them the link, and that will get them to it. Same thing with the curriculum. Once we get the curriculum loaded on the learning management system, you don't have to go onto the home page and find stuff. Yeah, so I mean, I appreciate that. And you know, it's like the thing about a huge website, it just becomes sometimes cumbersome. Anything else? Okay, well, thank you very much. It's been my pleasure to be here with you today.